Hi, my name is Dr. Catherine Bacus and I'm from Allevia Medical Weight Loss. At Allevia, we help people to lose weight and live their best life. I'd like to discuss something that has been really bothering me over the last year, and that is the treatment of people living with obesity during the shortage of weight loss medications that we've been experiencing over the last 12 months. To make my point, let's contrast two health conditions that we know well, asthma and obesity, and examine our attitudes towards them. Picture this. Sarah is a 45-year-old mum of 3 and full-time business executive, and she has a medical condition called asthma. Without treatment, Sarah's asthma flares up and she has difficulty controlling her breathing. But thankfully, there is an excellent treatment called a preventer that she can take. The preventer helps Sarah to manage her symptoms and remain well so that she can be active, run around with her kids and be at her healthiest. But then her preventer becomes in short supply. She can't get access to the right treatment anymore. She becomes increasingly breathless and she has difficulty keeping up with her children and doing her normal daily activities. And she's also at risk of dying prematurely. She attends her doctor or her pharmacy, and how do they respond? A, suck it up and breathe a bit harder. B, it's your fault you can't control your breathing. Or C, it's not your fault. We know that you'll need this treatment and we know it's in short supply. I'm sorry that you've been experiencing this at the moment and struggling, but let's see what we can do to find an alternative. So let's have a look at that situation and see what we'd expect health professionals and pharmacists to say. It's a no-brainer, right? We'd expect them to respond with compassion and to say, we know that this is difficult for you, let's find an alternative and let's get you back to your best health. Now, let's try another chronic health condition and see what response we'd expect. Sarah is a 45-year-old mum of 3 and full-time business executive, and she has a medical condition called obesity. Without treatment, Sarah starts to gain weight and she has difficulty controlling her hunger and cravings. However, there is a highly effective treatment for her condition. It's called a weight gain preventer. The preventer helps Sarah manage her symptoms and remain well so that she can be active, run around with her kids and be at her healthiest. But then her preventer becomes in short supply. She can't get access to the right treatment anymore. She becomes increasingly hungry. She starts to put on weight again, which is super frustrating because she's tried so hard to get it off. And she has difficulty doing normal daily activities and she's at risk of dying prematurely. She attends her doctor or pharmacy, and how do they respond? A, well, just eat less and move more, go on. B, it's your fault you can't control your eating. Or C, it's not your fault. We know that you need this treatment and we know it's in short supply. I'm sorry that you're struggling right now, but let's see what we can do to find an alternative to help you manage your health condition until it becomes available again. Obesity or excess weight is a chronic health condition. It's been recognised as such by numerous leading health experts, including the World Health Organization. Overweight and obesity affects 2/3 of the Australian population. It's time that we tackle this health condition seriously and provide effective treatments to people living with excess weight. Let's stop the stigma, get behind our patients and our friends and colleagues who are in need of help, and not give them our judgment. If you've experienced judgment about your health condition, we apologise on their behalf. You deserve better than that. And if you know someone else who's had experience with this and been shamed or judged at the pharmacy or with their health professionals, please feel free to share this post with them. You're not alone. At Allevia, we're working hard to change public attitudes with education about the science behind obesity. So if you need support, then reach out to your Allevia doctor or join the Weight Issues Network. I'll drop the link in the comments below. Thanks for listening. I'm Dr. Catherine Bacus and we look forward to seeing you again soon.